Welcome to the Healthy Body. Dr. Alex here. Today we're diving into a powerful, yet often overlooked truth about diabetes and blood sugar management. For many people, the real reason their blood sugar remains stubbornly high, even with medication, careful diet, and regular exercise, isn't just about carbs or insulin. It often comes down to missing three key vitamins that act like the hidden gears in your metabolic engine. These aren't just nice-to-have nutrients. They are essential players in keeping your glucose stable, your nerves and blood vessels protected, and your heart and kidneys safe from the silent damage diabetes causes day after day. In fact, research shows these vitamins can lower post-meal blood sugar spikes by as much as 20% and significantly reduce the risk of long-term complications. So, if you've been frustrated with your numbers not improving despite doing everything right, this may be the breakthrough you've been searching for. Before we get started, a quick invitation. If you'd like more practical, science-backed tips to support your energy, vitality, and overall health, I'd love for you to subscribe to The Healthy Body. That way, you won't miss any of our upcoming deep dives into nutrition, hormones, and natural strategies for living stronger at every age. Now, let's explore the first essential vitamin. Vitamin B6, pyridoxal 5-phosphate. Vitamin B6, especially in its active form known as pyridoxal 5-phosphate, is a nutrient that quietly influences over 100 different enzyme reactions in the body. These include how we process glucose, amino acids, and even neurotransmitters that regulate sleep, stress, and mood. For people with diabetes, this makes B6 a cornerstone of metabolic health. A deficiency doesn't just cause minor symptoms. It can quietly worsen insulin resistance, raise fasting blood sugar, and increase nerve and heart complications over time. Think of insulin as a key, and your cells as locked doors. Vitamin B6 helps grease the lock so insulin can slide the key in more smoothly. Without enough of it, those doors become stubborn, forcing your body to pump out more insulin just to get glucose into the cells. Over time, this strains your system and leads to higher and higher sugar levels. Clinical research shows that low B6 is linked to a 32% rise in insulin resistance markers. Supplementation with active B6 has been shown to reduce post-meal glucose spikes by over 20% in just 4 weeks. That's the difference between a dangerous surge and a controlled curve. And here's something many overlook. B6 plays a role in controlling gluconeogenesis, the process where your liver releases sugar into the bloodstream overnight. If you've ever wondered why your fasting glucose is high in the morning, even when you ate lightly the night before, low B6 may be part of the puzzle. Studies show that pairing B6 with magnesium can reduce those morning spikes by nearly 18%. But blood sugar control is just the beginning. Neuropathy, nerve damage in the hands, feet, and legs, is one of the most feared complications of diabetes. The active form of B6 is essential for building and repairing the myelin sheath, the protective coating around your nerves. When B6 runs low, myelin thins out, leaving nerves exposed and vulnerable. That's why deficiency is linked with more severe burning, tingling, and numbness. Clinical studies show that diabetics who supplemented with active B6 experienced up to a 41% reduction in nerve pain after 3 months, along with better reflexes and sensitivity. That's not just relief, that's quality of life being restored. The heart also benefits. B6 helps lower homocysteine, a harmful amino acid linked to clogged arteries and heart attacks. People with low B6 levels face up to a 34% higher risk of cardiovascular disease. Supplementation at safe doses of 20 to 50 milligrams daily can reduce inflammation inside blood vessels and improve their flexibility by about 25%. And let's not forget the kidneys. In diabetes, these filtering organs are often under siege. B6 helps reduce inflammation in the kidney's delicate tubules, lowers protein leakage into urine, and slows the early decline of kidney function. It also guards kidney tissue against oxidative stress triggered by high blood sugar. Beyond this, B6 strengthens immunity, supports red blood cell formation, improves digestive enzyme activity, and reduces the risk of fatty liver by enhancing fat metabolism. Food sources include chicken breast, salmon, bananas, spinach, and avocados. The average adult needs 1.3 to 1.7 milligrams daily, but people with diabetes may benefit from closer to 2.5 milligrams, especially if neuropathy or kidney issues are present. When diet isn't enough, supplements can help. The safest forms are pyridoxal 5-phosphate, P5P, available in options such as pure encapsulations, Thorne Research, or Now Foods. Doses of 20 to 50 milligrams are effective, but avoid exceeding 100 milligrams daily, as high doses may harm nerves rather than help them. Vitamin B12, methylcobalamin. Our second essential vitamin is B12, particularly in its active form, methylcobalamin. This nutrient is absolutely vital for nerve health, red blood cell formation, and brain function. Without it, the body begins to deteriorate silently, blood sugar climbs, nerves degenerate, and memory fades. Even mild B12 deficiency can increase insulin resistance by nearly 30% and push post-meal glucose spikes up by more than 20%. It can also raise HbA1c by over 1 percentage point. The hidden danger? Many people with diabetes are deficient without realizing it. One major reason is metformin, a common medication that triples the risk of B12 deficiency by blocking absorption in the gut. If you've been on metformin for years and haven't tested your B12 levels, it's like driving a car with a warning light flashing on the dashboard and ignoring it. Over time, the damage adds up. Deficiency strips away the protective coating on nerves, causing tingling, burning, and numbness that can become permanent if untreated. Studies show restoring B12 improves nerve conduction and reduces neuropathic pain by almost 40% when addressed early. B12 also protects the heart by lowering homocysteine, the same harmful amino acid I mentioned earlier. Elevated homocysteine stiffens arteries and increases stroke risk, while healthy B12 levels improve red blood cell health and reduce vascular inflammation by up to 20%. Your kidneys, brain, immune system, and liver also depend on B12. Low levels accelerate kidney decline, contribute to brain fog and mood disorders, weaken immune defense, and increase the risk of fatty liver disease. Symptoms of deficiency, fatigue, numbness, poor memory, confusion, are often blamed on aging, but in reality, they are red flags that your body is struggling at a cellular level. Natural food sources include clams, beef liver, salmon, grass-fed beef, and fortified nutritional yeast. However, absorption is often reduced in people with diabetes, which is why supplementation is so important. Safe and effective methylcobalamin supplements include Jarrow formulas, Garden of Life sprays, and Solgar capsules. While the daily requirement is only about 2.4 micrograms, many people with diabetes benefit from doses of 500 to 1,000 micrograms daily. Since B12 is water-soluble, excess amounts are usually excreted, but extremely high doses should still be avoided without medical supervision. Vitamin B9, L-methylfolate. The third vital nutrient is vitamin B9, better known as folate in food, and as L-methylfolate in its active supplemental form. Folate is a key player in DNA repair, cell division, and importantly, clearing homocysteine from the blood. In people with diabetes, folate deficiency is shockingly common and dangerous. Without it, homocysteine rises sharply, damaging blood vessels, nerves, and kidneys, while dramatically increasing stroke risk. Research shows supplementing with active folate can improve insulin sensitivity by up to 17%, lower HbA1c by up to 0.7%, and reduce fasting glucose by around 9% when combined with a low-glycemic diet. That's a significant difference in long-term outcomes. Folate also protects nerves by supporting myelin production, reduces kidney stress, improves artery flexibility, enhances blood flow in the eyes, and lowers the risk of fatty liver disease. In the brain, folate helps balance neurotransmitters like serotonin and dopamine, improving mood, memory, and focus. Deficiency symptoms often overlap with diabetes complications. Mouth ulcers, irritability, confusion, headaches, numbness, and frequent infections. In men, low folate can reduce testosterone and sperm quality. In women, it can disturb hormone balance. Rich food sources include lentils, asparagus, spinach, black-eyed peas, and avocados. But for many diabetics, especially those with an MTHFR gene variation, the body cannot effectively convert folic acid into active folate. In these cases, supplementation with L-methylfolate is essential. Top options include Methylpro, Thorn 5-MTHF, and pure encapsulations. The usual daily requirement is 400 to 600 micrograms, but people with diabetes often need 800 to 1000 micrograms under professional supervision. Before we wrap up, let me pause here for a moment. If you're finding this information helpful and want to keep learning natural, science-based strategies to protect your health and energy, make sure to subscribe to The Healthy Body. That way, you'll never miss a new video designed to help you thrive at every stage of life. Closing thoughts. When it comes to managing diabetes, most people focus only on carbs, exercise, or medications. But your body is like an orchestra. And without these 3 key vitamins, the music falls apart. Vitamin B6, vitamin B12, and folate aren't optional extras. They are the foundation that keeps your blood sugar stable, your nerves protected, your heart and kidneys strong, and your brain sharp. So don't overlook them. Test your levels. Add more of their natural food sources into your meals. And if needed, use the active supplemental forms to restore balance and resilience. Your health is your most valuable investment. With the right tools and nutrients, you can slow, even reverse, much of the damage diabetes tries to cause. Thank you for joining me today. If this video gave you clarity or practical steps you can use, I'd love for you to subscribe to The Healthy Body. It's the natural next step to stay informed, supported, and inspired on your journey to better health. Stay strong, stay informed, and I'll see you in the next video.